Hi, I'm Dr. Alvarez with Endobariatric.com and welcome to Bariatric Surgery 101. Today I want to do or start something a little different. For the next few videos I want to explain from the basics what bariatric surgery is, and today I want to talk to you about how bariatric surgery is achieved, how do we do bariatric surgery nowadays, a little bit of history, and how bariatric surgeries are classified. First of all, I want to start off by saying that bariatric surgery is a very safe operation. The reason it exists is because the goal of bariatric surgery is to increase your quality of life and increase your lifespan. If you're suffering from obesity, those two are our main goals. Increase your lifespan, for you to live longer on this planet, and for you to have a better quality of life. That's the goal. If you stay being overweight, your lifespan will be shortened and your quality of life will be, well, not that good. So nowadays, bariatric surgery is achieved with minimal invasive surgery techniques. This is laparoscopic surgery. Back in the old days, yes, we used to do big incisions. We would cut all through the abdominal wall layers, very painful, hard recovery, and we don't do that anymore. Nowadays, we do achieve weight loss surgery with minimal invasive surgery, which is laparoscopic surgery, which is also known as keyhole surgery, which is what you see on my Instagram stories, that we use cameras. We introduce a little camera inside your abdomen. We see the projection on screens, and we're able to craft a new stomach, perform these surgeries through a little camera and laparoscopic surgery. This will give us a big advantage regarding recovery. Your recovery is very fast. Patients are back in action next few days after surgery, and less pain because there's no big incision that cuts through all the abdominal wall layers. So all this nowadays is achieved with minimally invasive surgery, and therefore whenever minimally invasive surgery is performed, laparoscopic surgery involves general anesthesia, because that's a very common question. What type of anesthesia do you use? Well, here, New York, China, wherever, the use of general anesthesia is mandatory for you to be relaxed, muscle relaxed, for you to have an abdominal wall relaxed. That way we can insufflate the abdomen, have enough space for us to create or craft the surgery itself. So general surgery, general anesthesia is mandatory. Patients don't notice a thing. You don't feel a thing. It's just it feels, for the patient, it really feels like a blink of an eye. So it really is stress-free, at least in our practice. So that's how nowadays weight loss surgery is crafted with minimally invasive surgery through general anesthesia. And now I want to explain a little bit about how nowadays bariatric surgery or weight loss surgery is classified. And it's classified mainly in two big categories, which is restrictive procedures, something that will limit the intake of food or calories, and we're going to talk a little bit of history, and in future videos I will explain a little bit more on each precise procedure. The lap band is a purely restrictive procedure, and we would limit the amount of intake food would go in. Gastric sleeve is also classified as restrictive because we are crafting a new pouch, a new stomach, a new capacity, and that's restrictive. Although there are some metabolic good features on this procedure as well. And then we have malabsorption procedures that, as the name says, it will produce malabsorption of nutrients. We're looking for you to have less absorption of calories, less absorption of nutrients, and then we have a combination of procedures or classification that is a compound of the restriction and the malabsorption, which is like the gastric bypass, where we craft a new tiny pouch, smaller pouch, which gives you the restrictive category, and we cut the intestine and we we bypass a certain part of the intestine, causing the malabsorption. This will be a compound, the malabsorption and the restriction. So those are mainly the main categories on weight loss surgery. We have the purely restrictive, we have the purely malabsorption, and then we have the combination of both. So in future videos, I will talk about each and one of the procedures that are mainly done nowadays, maybe talk a little bit about history, procedures that are not authorized nowadays, some intestinal bypasses, the gastroplasty, a procedure done very popular in the 80s and 90s with a big open incision that's not done nowadays as well. And then we'll talk about what is currently done nowadays. I hope you find this video useful. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.